All right, Renee, are we ready to go?
Yes, ma'am.
All right, thank you, everyone. Tonight is Wednesday, September 4th, and this is the meeting of the East Long Meadow Board of Health. The Board of Health is recording. Is anyone else recording? Okay, so I'm going to call this meeting to order, and we are meeting tonight via Zoom webinar pursuant to former Governor Baker's March 2020 order rescinding certain provisions of the open meeting law in Massachusetts, which is extended by Governor Healy. So with all those announcements out of the way, first thing on our agenda is to approve the minutes of the prior meeting. So ladies, does anybody have any changes to the minutes for the prior meeting?
No.
No. Okay. So I'm going to make a motion that we approve the minutes of the last meeting as written.
Okay, I second that.
All right. And we're going to do a roll call vote. So Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
Rebecca Torsha?
Aye.
All right, thank you. Meeting minutes from the last meeting are approved. Renee, is anybody here for public comment?
We do have some participants. Is there anybody that would like to make any type of comment? I think there's a raise hand option. Oh, it looks like we're good.
All right. So if we have no one for public comment, we are going to move on to the next item on our agenda, which is a Title V variance review for 3 James Street in East Long Meadow. This variance review is for the property owner to basically install septic versus connecting to the sewer. So Tammy, I'm going to defer to you at this point.
Okay, so I'll just explain kind of how it goes. These don't happen very often. Probably the second one in my 20-something year career. So whenever there is a new construction, and the owner would like to put in a septic system versus a sewer, because Title V says new construction has to be, if there is a feasibility for hookup to sewer, they have to hook up to sewer. They have to apply for a variance if they want to do that. And they also have to prove that it's manifestly unjust. Basically, the difference between the price of the sewer and the septic system, if it is a large enough difference, they could call that manifestly unjust. So that is what we're doing today. We're kind of looking over we've already looked over the plans. We've looked over the quotes for the septic and the quotes for the sewer hookup. All that stuff has been on view at the health department for anybody who want to take a look at it. I have reviewed the plans. I've talked with their designer just to make sure everything looks good. I've also had the Department of Environmental Protection take a look at the plans too, just to make sure that I didn't miss anything. And I think that the plan does provide equal or greater environmental protection as to a sewer. So basically, the decision would just be whether or not we think that the difference in the quotes is manifestly unjust. And I don't think there's really any reason not to approve the variance to allow him to apply for a disposal system construction works permit. So if there's questions about that.
I was just going to say, Katie or Rebecca, do you have any questions for Tammy?
Nope. No. I was just going to say, why is he applying for the septic versus
because of the difference in the price of the hookup from the septic system to
okay.
If you have the quotes here,
they're pretty different.
They are, I think the septic's about 13,000 and the sewer is 40.
Okay.
Yeah, 13,929 for, so about 14,000 for the septic system, and 51,130 and 32 cents for the hookup to to town sewer. I think there's like 2 manhole covers that would have to be not installed, but that's the length of how far the hookup would have to be for that
Sure.
property.
Okay, makes
yeah.
sense. Sure.
But the plan has everything it needs. It fits all of the requirements of Title V. Even if there's, so if obviously eventually septic systems have to be replaced, there's enough room for a second one if need be. And I don't see any reason why we couldn't allow him to apply for it.
Ladies, do you have anything other before we take a vote?
No, makes sense. Mhm.
Okay. Katie, are you good to take a vote?
Yep.
Okay, so I will make a motion, that we would allow the owner of 3 James, to apply for a disposal construction works permit.
Okay, I'll second that.
All right, thank you, and we will do a roll call vote. Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
Rebecca Torsha?
Aye.
All right, so that motion has been approved, so the owner of 3 James can go ahead and apply for that disposal construction works permit.
So I don't know if Mr. Wiederburn is on the is he on the Zoom? Can you tell? I will have the permit available at the health department at 9 a.m. on Friday morning. I just have to kind of redo all of the paperwork and approve it, and it will be there for pickup. I will also send, so I'll have to write this up and send it to everybody here and have that for the minutes, but I will also be contacting in the morning Mr. Wiederberg just to make sure he knows that his permit will be there to be picked up.
I'm sorry, Mr. Wiederburn, did you want to become to say anything, or is that suffice? You're okay. All right, cool.
All right, thank you, Tammy. Thank you, Renee. All right, we're gonna move on. So the next item on our agenda is a vote on increasing the mattress disposal fee from $15 to $30. So Tammy, I'm going to turn this one back over to you as well.
Okay. So a few things to consider about the mattress disposal fee. So currently it is $15 to dispose of a mattress at a transfer station. Originally, the price for the town to dispose of it was $15. And then it became $15 plus a pickup, which the pickup originally when we started the program was a little bit less, but now it's $250 every time they have to empty the container. We used to be able to cover it by a grant, but our grant now doesn't really, well, the grant's never increased. The RDP grant has never really increased over the years, but everything else increases. So that's not the fun. That's the bad news when that happens. We got a letter, was it last month, I think, Renee, that they're increasing to $17 a mattress for the pickup.
That is correct.
Yeah. So we felt that the $30 was enough to cover that $17 increase and the $250 every time they pick up the mattresses. $300 is still, or $30 is still pretty low. If you look at, I had sent you the list of a lot of other towns that municipally pick it up and how much it costs for private pickup. If you're going to do anything private, it's at least $100, $100 to $150. We've found, and $30 to $45 is pretty average for most towns that did municipal drop off. And I mean, some months we get a lot, some months we don't. Some other things we have to take in consideration is that there have been that the container that they put it in has been damaged a little bit over the years just because of where it's situated with like the other containers and transfer station. So we'll probably have to replace that. I'm not sure if it'll be like the next year or a year or two. And they originally, I think we bought that for $5,000, but that was in 2000, I think 17, Liz might have said. So we've had it for a bit. So I'm guessing that that's not the price of a giant shipping crate anymore. So that is our that's what we came up with for the fee increase. And as always, it would be if you do approve it, or if you approve a different amount, because you guys could choose a different amount. It would be a vote to approve the fee for the town council for adoption to the bylaw fee schedule.
My only question, and then I will defer to the other members. Just curious, we charge the same fee no matter what size mattress you bring over there?
It's just kind of easier for the person who staffs that front or the little booth. It just seems there are towns that do like a 30 for this side for twin, 45, but it doesn't really I don't think it would make it any easier for whoever is working at the booth to figure that one out.
Yeah. Katie, Rebecca, any questions for Tammy?
No, but good question. Thinking a California King versus a twin, there is a big difference, but yeah, makes sense. Okay.
I think it might it used to be like a free takeaway from most places when you bought a new mattress, but I feel like most places now don't even do that. So this is sort of, you've got your $50 transfer station sticker. It's kind of a no-brainer to still bring it to the transfer station. Wednesdays and Saturdays, 9 to 5.
If you can. Not everybody can put a mattress in their car.
Especially not
Driving a Honda
California King.
Civic. Ladies, any other discussion on this item? No.
Nope, sounds good.
All right. Rebecca, do you want me to make the motion? I'm happy to.
Oh, I can make the motion.
Okay,
A motion.
go for it then.
Oh, the motion to, what's the proper verbiage? To allow the price,
To recommend to the
recommend-
price increase to the town council,
Yeah,
right,
whatever.
for
The
inclusion.
proper,
Okay.
I
so
motion that, yeah.
Go ahead and say that.
A motion to recommend the pricing increase on the town mattress to the mattress to the town council.
I second.
All right, roll call vote, Christine Johnston, aye, Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
All right, so that motion has passed as well. So Tammy, you can add that to the minutes and put that on the next time the town council is looking at fees.
Perfect.
All right, next thing on here is recycling and trash program updates. So Tammy, that is you.
I feel like there's been so many different events that we're scheduling. So Liz put together a nice list of things that have been going on. Actually, it starts off, she did do a podcast at the senior center, which you can get on, I believe, the town's website, kind of just to talk about recycling and recycling coordinator. And if anybody hasn't kind of seen the senior center podcast, I highly recommend it. It's kind of a nice little program that they're doing. Let's see. Heart Springs continues to pick up second Saturdays of the month at the parking lot outside of Town Hall in Center Square, and I believe this Saturday is the second Saturday of the month. Let me make sure that before I say that. And so you don't have to bring just clothes like our drop box behind the fire station.
This would be the first
Oh, I'm
Saturday.
sorry, it's the first. So the following Saturday will be the second Saturday. But you can bring home goods. I think like smaller furniture things, not like couches and stuff like that. But you can bring out like toys, kitchen supplies, stuff that we don't do at the textiles bin. But since they have started, and I think we started, I feel like we started maybe right before Earth Day this year, so that would have been April. They have picked up 13,906 pounds of textiles. So that combines both the Saturday pickup, second Saturday, and at the textile recycling behind the fire station. That's a lot of things not going in the landfill, which I think is great. Let's see, then, so this Saturday, the PTO is having a recycling event at the high school in the parking lot. I think it's mostly electronics.
Yeah,
think.
I was gonna say, I think this one is electronics.
They're
Yeah.
also doing shredding.
Yes. We're not doing it with them, but we were just kind of promoting their event. But September 14th, we have combined with Representative Ash's office, and we'll be back at the high school. And they're taking styrofoam, dehumidifiers, furniture, electronics, clothing, and canned goods. I think that'll be 10 to 2 next Saturday, the 14th. And I've kind of decided that I like that the residents have the option to go to NEDT in Westfield to bring hazardous materials, like your oils and your lead-based paints and things like that. But I felt that we've gotten enough phone calls and inquiries that I think we should bring back a hazardous waste day in town. We're still kind of trying to figure out the details of that. We had asked to do it sometime in early October at the fire station with Clean Harbors, but we haven't heard back from them yet. So I know this is I think it's kind of a big time of year where people start doing a lot of clean out. So that they might already kind of be booked up, but I'd really like to bring that back just so that we can get those people that might not have the access to go to Westfield to bring those items. But that being said, there's so many things that an East Longmeadow resident can dispose of for free up to a certain amount. So I encourage anybody to go on our website, check out how you can go through that process. It really isn't, all you have to have is your driver's license or maybe like some sort of form of identification that says you're an East Longmeadow resident. But once we get that event, I'll let everybody know, and we'll be posting that online. And then, so I think this is the 3rd year that Liz has been doing the tools for teaching in the schools. And so a big time that waste is generated at the end of the year at schools is, when the teachers are cleaning out their classrooms. So this is like one way to kind of prevent that stuff from getting put in the landfill. Liz puts boxes, actually she puts them up in town hall too, just in case anybody wants to get rid of things like binders and pencils and stuff that they don't use. And they go to Springfield teachers who need to utilize, I think it's almost like a donation store that they use. And I believe, let's see, and they had sent us a really big thanks. And you could go to facebook.com/tools for teaching MA/photos, and you can see some of the photos from the students who get to take advantage of that. So I think it's a really neat event. And that is recycling and trash program updates. I know that was a lot, so if there's any questions, just let me know.
Thanks for sharing that. Any questions, ladies? No?
Good, thank you, good.
Awesome. All right. Tammy, health department updates.
Okay. So I was gonna give news from the desk of the town health nurse, but it seems like she's here right now. So do you want to give your kind of your summer updates, Chris? You just have to put your volume up.
Hi, So I gave you my little bulletin of what I've been doing, and you put me on the spot, so everything just kind of goes whip right out of my head. But
I can
off the
read them.
top
I
of my
can read them
head-
off if you want.
Oh,
I can-
sure.
How about I briefly say a few words and then that'll.
Okay.
Okay. Bullet point number 1. Dementia Friends Champion.
Oh, yeah. Yep. That was like a 3-hour Zoom training. Well, actually, it might have been a little bit longer, but through dementia training. The woman's name is Beth. No, I can't think of her last name. So I am dementia friendly trained, so I can actually go into actually I'm working on collaborating with Katie at the library to just do my very first training with the staff at the library. And she said she would give me a date, throw a date out for me, maybe sometime next month. So I'll get to put my material to work and they can critique me after. The other thing that I did was through the AARP on the age, am I saying it right? Age-friendly living. What was it, Tammy?
Age-friendly communities, is that it?
Yeah. And that's kind of an initiative through the COA from Aaron and also through Rebecca to kind of get a little more familiar with our community and how we can go about making it more of an age-friendly community. So I did that, very interesting. So I'm kind of certified with that. I guess it's a certification. So I put in like 2 days of that. Let's see, what else was on my list?
Michelle Cruz at
What
Brownstone.
was it?
Michelle.
Oh, yeah. So I'm going into other areas in town, other than the, I've done the Inward Commons, Quarry Hill, and Village Green. I also contacted Michelle Cruz. She is like the activity director for Brownstone Gardens. So I've set up with blood pressure clinics with them also. So I'll go over to Brownstone 1 and 2 and do it 1 month or 1 day a month there. And then the other one over by the police station, 1 day a month. Not such a huge turnout just yet, but she puts the bulletin out there so the residents will come and they know I'm there. And so a little bit of an interest. What else did I do?
Memory Cafe.
Oh, that's with the COA. Aaron put that together with Trinity Health, or no, I'm sorry, Fallon. They come twice a month. And I just basically sit there and kind of, I'm more of an observer to see how they run their cafe. And then, I'll talk to the members at the COA that come in. But the last time I was there, we only had one resident come in and sit with us and talk about the Memory Cafe. So hopefully the next meeting, there'll be more members coming in. I think that's it. And I've been doing the classes still. No
Which
walking
ones do you have?
trail.
Oh,
What's that?
which
I'm
classes?
sorry.
Which classes are you still offering?
It's kind of like a combination of, it's like advanced chair, we call it, but with the advanced chair, and they do very well. Light weights, a little bit of cardio, a little bit of stretching. I throw in a little bit of bar exercise with it too. They don't know that. And kind of like a little bit of ab workout while you're seated. And they do really well. I'm surprised how well they do. I shouldn't be surprised, but they do a wonderful job. And I really, that's one of my favorite things to do. It's a lot of fun. And I think that's it. Other than going on Maven and checking all that other stuff out.
The you know what I was thinking of? You have been representing the health department on, okay, what are we calling it? Uh our at-risk, what is it we're called? What's the new committee called? We've only formed it a few months ago, the town. Somebody put in some requests to add people today. What do we call that? I'm sorry.
I don't,
Um, hold on. You know, with the senior center and
Senior watch.
senior watch. Thank you.
yeah, yeah. That, Danelle runs that and I participate in that, with the senior watch. So it's the, girls at the COA, Alex, myself, Chris Beecher comes in. He's pretty much the eyes and ears of who needs a lot of the emergent attention. So he gives us the referrals to go and see if we can connect with these residents in the community.
And this was sort of like, I think it was there are other towns that do something sort of similar, but I think that we've all informally, when we do, you know, when say health department gets a hoarding call and it's, you know, somebody who's a senior who's living at home, you know, we kind of individually start, you know, contacting fire department, contacting council on aging, and sort of, we were doing it kind of disparately, but this way we can, you know, put people who are on our watch, maybe they're just starting to get some symptoms that might have things that, you know, they can't get in and out of bed. They maybe are starting some, I don't want to call light hoarding, but there are stages to hoarding that might, you know, start to steamroll down the line. And, you know, we've had injuries from, you know, our EMS team going into houses.
We've been dealing, well, not myself, but Chris Beecher has a list of people that are concerned for increased fall risks. And Erin is aware of that also. So we're gonna be working on that, see if we
I
can
think
make
from
a
the
connection
community-
with them.
I think.
Go
from the
ahead, I'm
community-
sorry.
No, I was saying, so as a physician in the community, I think it's important that if people want to know how to do this, we should at least say this so then people can read the minutes. So how would they get their parent or their loved one or a neighbor added to this list so they can be aware of this? I think that's really important.
That
I think
is,
the
yeah,
first
thanks
thing
for that.
the first thing would not be to add them to the list, but I would say to call the Council on Aging to see what's available. You know, it might be something that you might think is on the list, but it might not be to that point where it would be. But if there's something that's a concern to them, I think that would be the best place to start. Because it might just be that maybe maybe they need a little extra service like Meals on Wheels, or, you know, some of the groceries, or that kind of thing. And it might not be that to that extent. But I think for the most part, a lot of the people that we have on the list don't have that family support. And that's, you know, it's unfortunate, but that's just kind of the world we live in these days. But we also, through, I believe it's through some of like the opioid funding, that the opioid settlement funding and some other things that the town had received, East Long Meadow Police Department and Long Meadow Police Department were able to hire a social worker, Jamie Fraser, I believe her name is. And so that is great because I can talk to somebody, you know, till I'm blue in the face to why you need to clean your house, or, you know, what this order, you know, to clean up your houses. But I think it's better to hear it from an actual social worker onto why those things are important, and kind of to distance, you know, it's you know, it's my inclination, even when we were sitting there sending violation letters or orders to correct, to want to help the person. But, you know, legally I have to, you know, write these orders up, or Alex has to do the same thing. And you know, we're kind of always trying to, you know, buffer that, but, you know, it's still a order of correction. It's still a violation if we come across those things. So it's nice to be able to have that kind of level to explain why that has to be done, explain why you might be getting this order. I mean, we don't get them a lot, but we get them enough that it can become, you know, it can become a load on the health department. Anyway, I didn't mean to steal your thunder, Chris. Let's see. Oh, and then I put down an extra note that you and I will be staffing the health department / first aid booth on Friday at the Little E at the Council on Aging.
Me at the COA, come see us.
Yes. And there's usually lots of activities to, you know, you don't have to be a senior to come to the Little E. Maybe just somebody who doesn't really like the idea of having to walk around the exposition center or park. I know they have lots of they last year they had a really neat like circus show, which was kind of fun. But usually they like to have somebody for when the pie eating contest come to watch out, and that could get messy and dangerous depending on how hot it might be on a Friday. So anyway, anything else you want to bring up, Chris? Good. Okay. Let's see. And this will be the COVID. I'll bring this up, and if afterwards, if Katie'd like to chime in with anything you're seeing at the hospitals, that'd be great. I don't feel like it's probably any surprise to anybody that COVID has really been going around. The amount of phone calls, text messages, emails that I've been getting. What do I do? Where do I get a test? What are the protocols, if any? Have been the last like 3 weeks have been pretty steady. The first question I can answer is, where can I get a test? Well, right now you can get them for free at the health department. We were able to get a large supply of them from the federal government, and they are all within the expiration. They're good. So feel free to come by the health department. If you think you're sick, maybe send somebody else or give us a call. We are no stranger to going out into the parking lot and roll down your window and we'll hand you a couple. As for what do I do now that I know that I have COVID, it's a lot different than it's been in the past, now that they've lumped it with other respiratory diseases like flu and RSV. But I felt like one of our counterparts in Northampton, Jennifer Brown, she's a public health nurse. She summed it up super quick into 2 bullet points. Phase 1, stay sick until your fever resolves for 24 hours or your symptoms improve. Then
Stay home. Stay home, not stay sick.
Stay home. Stay home. Stay home when sick. I'm sorry. Stay home when sick until your fever resolves for 24 hours or your symptoms improve. Granted, that doesn't seem like a real long period of time.
And without medication. So that's the other caveat too. So you stay home while sick and have had no fever for 24 hours without taking acetaminophen, ibuprofen, or anything like that. If you are still taking medication, that doesn't count.
Yeah, exactly. And then for the next 5 days afterwards, we'll call that phase 2, taking additional precautions. And those could be wearing a mask, social distancing, increasing hand washing. And then someone wrote, we're testing to see grandma at the nursing home. I never noticed that she wrote that in there, but I like that it was just, 2 points. Stay home if you're sick. Stay home if you have a fever until it resolves. And then if you have to go back to work, do those things. That being said, whatever your child's school's protocols are, that's your child's school's protocols. And it could be completely different. I've seen some of the ones for East Long Meadow and they are, but that's for East Long Meadow schools to bring up.
It's also the same for different employers. Different employers have different return to work dates. And if you have to wear a mask. So I would just encourage people to ask their employers how to handle it as well too.
And Chris, you've been reaching out to try to get some COVID vaccine clinics in the fall. We're just waiting to hear back.
Yes.
So
And if
we'll
you're sick and it's not COVID, stay home anyways.
Yes.
there's a lot of that going around as well.
Well, and just so you all know, the hospital at Bay State, we changed our visitor policy again because it was so rampant. So we went back to a stage yellow, it's called. And so that way, you know, everyone, all the physicians and APPs or any clinicians who are at the bedside or in patient care, we're wearing masks now with direct patient care again. And the same thing applies, obviously, if we're trying to reduce the number of visitors just from a safety perspective. So that way, someone from the community does not come in and give it to a patient or their roommate or someone who's working in the hospital as well, too. And the other thing I would really encourage people to do, especially right now with the mosquitoes, is we've seen a really high influx of mosquito-borne illnesses in New England. And that people should be using DEET spray, especially now it's like soccer season, football season, you know, all the outdoor sports that are going later in this year. And there's been a really big concern of vector-borne disease with mosquitoes. So making sure people are wearing DEET and lots of bug spray.
Are there any other things that you've been kind of seeing at the hospital?
Well, again, all the other things we talked about, like.
No, I didn't know if there was anything other than, you know, any other respiratories that we should be.
So I
on the
mean,
lookout
I think,
for.
you know, we're seeing a lot of still community acquired pneumonia. There was a lot of it in June, July, and August, which is very rare, but we had a ton of community acquired pneumonias. And it's the classic, you know, someone gets a little bit of a viral illness, it doesn't get better. Both of my sons ended up getting pneumonia. I know of and strep at the same time. It was great.
Oh,
So
Oh, it
it
roared
was-
through the school system.
yeah, it went through all the schools. My son wants me to tell you he couldn't play baseball because he was so sick.
Now that is horrible.
So he was devastated. But I think so that thankfully is stabilized. But really, I think what we're seeing is the normal pattern now of like the beginning of fall, we're starting to see people get respiratory illnesses again. So making sure people are getting their flu vaccine and the COVID vaccines, which I know they're updating and coming out with new ones. If you're over 65 or have immunocompromised states, making sure you're getting the pneumonia vaccine, which the new one has come out. And then really, again, hand hygiene and like you all said, if you're sick, stay home. And I really am encouraging people if they are sick to test for COVID just because it is so highly contagious. And many people who have never gotten it before are getting it now. I know of at least 10 people in the last 2 weeks who have never tested positive, who are all positive. That's friends, family, and other people I know, not even patients. So I think it's just, this is the time that it's now catching up to those people who didn't get it the big times. We've had surges before, so.
Awesome. And so speaking of COVID and other respiratory diseases, we do have our annual drive-through clinics, annual flu drive-through clinics scheduled with Big Y. We're not doing them back to back this year, just because of the way they had to schedule it. So we're doing one on October 15th at the fire station from 1 to 6. So typically our families usually tend to do that one, or people who can't make it during the workday. And then on October 21st, we'll be doing our daytime one from 8 to 1 at the senior center. But anyone 5 and up is welcome to come to that. I'll tell you, last year, the 2 vaccinators that they had, I've never seen this before, and I hope we get them again. They were amazing. I saw one of them vaccinate a car with, I think, 3 children in it in under 4 minutes. Not an exclamation. I've never seen that as a mom of a young child who's been to drive-through. I've never seen that before. So I'm hoping we get especially one of them again, because I couldn't believe how amazing he was with the kids. So we have those. The registration, it's encouraged just to kind of keep it along, because sometimes we do have long lines. You can find it on our website. You can find it on the Facebook page. And on it, you can download the form just so that you have it ready to go. And you can drive in and drive out. So that's the food clinics.
And for folks who have littler kids, I've already gotten an alert from my pediatrician that they are starting to set up appointments if your kid's under 5 for flu shots or flu vaccines. So just, I know that they have it, or they have it on order.
That's fantastic. I know that some of the pharmacies, do they now go usually at 3 maybe. I feel like they've lowered the ages over the last couple of years for the for flu vaccine at the pharmacies, but I can't think of how low they go down. But it's usually not. Yeah, I mean, I think it might be 3 and up. But
It's
you know,
certain pharmacies are able to do that. You have to look on their website though, and each of them will have the regulations. They'll have you put in a date of birth, and then they'll tell you which ones you can go to.
Fantastic. So I encourage everybody to get vaccinated. Let's have a healthy fall, healthy winter. And last on my list is I have just kind of a mosquito season update. I don't know if anybody got some of the alerts, but earlier in the summer we did have some positive mosquito samples for West Nile virus in town. We haven't had one for a while, which I'm hoping is a good sign.
Now it's
With-
triple E.
Yeah, well, let's just hope. I mean, usually if we do get triple E out here, it typically tends to be a mosquito that's traveled really far, because we don't have cedar swamps out here in Western Mass, which you've been seeing a lot in the kind of the Worcester Central corridor right now, which they do have, like Blackstone is, I think, a cedar swamp. So that's where they're doing spraying. There's really, with what we have out here with the mosquitoes that we have, most of our mosquitoes are found, in catch basins and at the ground level, and spraying is really not it's not the best option for that, because as soon as it rains, as soon as it starts to deactivate over the course of a couple hours, it stops getting rid of adult mosquitoes. So this is our first year where we've automatically decided to do more than 2 catch basin treatments throughout town. We've been doing them typically around the parks and the schools, just to cover the people who are out and about at night. If you are in your own home, we're still encouraging. The West Nile virus mosquito is the type of mosquito that grows in develops in standing water. So we've said it over and over again. Check out your backyard. Make sure that anything that you have with standing water is tipped over. Making sure that, same thing with Lyme disease, cutting and the mosquitoes, cutting back any, weeds, grass, bushes that need to be cut back, just so that you have no places where things could start collecting standing water. Right now we are, we're still only in the moderate level for West Nile virus, and that really just means that we've had positive sample, and that locally, which means in the county, there's been at least 1 person that tested positive for West Nile virus. There was some confusion about whether or not they were in East Long Meadow. That is not information that the state gives out. You just get if it's in the county. It just so happened that was a week that we had a positive pool, and I think Channel 22 confused it and said that we had a positive person. But we wouldn't know that unless that person decided to blast it over social media. But when you're in the moderate level, let's see, from the state's risk map, the things that basically, as you go up a level, you're adding levels of protection onto your general awareness of what you're doing. So like right now, being prepared is the number 1. Checking the risk map, checking with your local authorities of where you are. Wearing mosquito repellent between dusk and dawn, wearing long sleeves and long pants from dusk and dawn, and using nets on like carriages and playpens if you're going to be hanging out at night. So when you're at moderate, you're just increasing it to wearing mosquito repellent when outdoors, not just between dusk and dawn, and that you're making sure that you're dumping your standing water. So like I said, we're still in that moderate phase. If we were to go up higher, that's when we're talking about things where it might be like adjusting outdoor activities with our parks and rec and our schools. So far, we've made it a little bit into September. We haven't had to do that. I have been talking to the Parks Department on ways that maybe for the next season, we can talk about more of a prevention plan Kind of similar to how recreational camps do it in the summertime, with having sign-offs and appropriate ways to use bug repellent, because really bug repellent is the number one way that when you're going out to do an activity somewhere that you're going to be keeping yourself safe. And I watched a webinar recently about how we really need to start treating bug repellent like we treat using a seatbelt. And it's these summer mosquito-borne diseases, tick-borne diseases, they're here to stay. If we want to enjoy the outdoors, we have to do it alongside of them. So we have to get used to making it part of, like we do with sunblock as well, making it part of it. So that's something that we're trying to work on for next year, because outside of a few school systems I've seen, not in Massachusetts, not many programs kind of have a procedure for that. Because it would be, it would be better to, I think it would be better to figure out ways that kids can still do some of these activities than saying, hey, we're going to stop, we're going to stop playing at all. I think you have to benefit those, or weigh those benefits. So that's just something that we're working on the air. And also, so we still have our risk for Tripoli still low. We haven't had any positive pools in our town or local towns, but that's still on the lookout. It's not too late, but right now we've kind of typically left what's considered the Triple E season, and we're kind of in heavy West Nile virus season. But it's still never too late. Things, I feel like, with our changing climate, we never know what to expect when it comes to the bugs in the summertime. So that is a mouthful, but that is all I've got for everybody today. Any questions, comments?
Thanks, Tammy. Katie, Rebecca, questions, comments, thoughts, ideas? Great.
It's been a busy summer, but it's kind of September, sort of it's kind of the beginning of a different, I feel, season for how we do things. We're starting to gear up again for renewals, which, is always a fun, but still taxing time of year, having to go through all the permits and everything like that. But it just, poor Alex won't have to do as many food trucks once the weather starts getting a little colder, taking those inspections indoors. There'll be less phone calls about high grass, and we'll start moving into nobody's raking their lawns to what do we do about the snow on the sidewalks? So it's kind of a fun way that the year kind of changes. So it kind of keeps us on our toes and keeps us from getting bored.
Should we schedule our next meeting, speaking of that?
Sounds
sure.
good.
So, one of the things that we had talked about was having someone from either MHB or MHOA come, but there was nobody available this summer. So, and then I thought with this meeting, that would have been way too much to ask. So I can reach back out to them and see if one of the people who either come talk to us or somebody else for the next meeting, just to talk about those changes in the model regulations, just to see if it's something worth us kind of looking through and adopting. It seems like there might be some things that might benefit us if we change them, the regulations.
Do we want to look at calendars and give them a date or a couple of dates? That's probably better than us saying, when are you free?
I mean, they get paid.
Also, I'm just warning everyone, I have 2 children who are on competitive travel teams.
Uh-oh.
So it's very hard in October.
Got it.
When I wanted to ask, is there another meeting that the town normally has on Mondays? Monday is the only day I don't have any. I literally have something every day of the week other than Monday.
So, the workaround we have, if there if there happens to be another Zoom meeting, or Zoom webinar, so we're in webinar mode. So the other option is to just be in meeting mode. So really the only thing that would require is kind of letting people in and out, and if people are coming to view. So if we're not having a meeting where we're voting on things, it's probably not a problem. But if, say, we were going to do a public hearing to vote on the tobacco regulations, that could be a problem that you would want to be able to wrangle in everybody and keep kind of voices down and whatnot. That's the only problem with the webinar, or the webinar versus meeting Zoom modes.
And
But we
we-
can always use that.
Can we still record? We can still record a meeting.
Yeah.
Oh yeah, it would be the same. It just I think so. In order to view the meeting, you kind of have to be a participant, but you can have people in
Yeah.
in silent mode.
Yeah.
I only have
The host
5
can
nights
set
in
it up so that you can, like, you have to ask people to, like, people have to ask to unmute, I think.
I only have 5 nights in October. So should I just tell you guys those dates?
Tell us your nights, Katie.
Okay, October 7th. October 21st. October 22nd. The 28th or the 30th. No, I lied. Yep, the 30th I can do.
I vote for the 22nd because of all of the drive-through clinics that are on.
I have work the night of the 22nd. It's the only one of Katie's dates that I cannot do.
Well, actually, no, the 21st one ends at 1 p.m. Never mind. That's not the evening one.
I'm very sorry.
How does Monday the 21st look then?
Works for me.
Wow.
It works for me.
Okay.
Katie, I have sports 2 nights a week as well, so don't worry about it.
Well, it's funny
Me
because
too, but they're my sports.
I did, well, they both are on travel teams, and so they have 2 practices a week, and
Mhm.
then I know, so sorry.
I love it.
10/21,
10, yeah, that sounds great.
that's a Monday. So Tammy, just, I think for this meeting, it'll be fine because we're not going to be voting on anything. If the Zoom webinar is not available, to just do a meeting.
Yeah. Renee sent a reminder that on the 17th, I have to have the posting up.
I'm on
Yeah.
it.
Put a reminder.
That's the only thing
And
about a
Tim-
Monday meeting. You have to really make sure that you've had that 48-hour
Business
notice.
hour, yeah.
Put
And
it
you'll
on the reminder right now.
And you'll invite the folks from the Tobacco Commission?
Yep. I mean, even if not, I'm sure there'll be plenty of things we can talk about. There's always, it's October.
Awesome.
A lot of things that make us sick all year, so that we'll be preventing.
Right.
Yeah.
Then I will make a motion that we close the meeting.
I
will
second
second.
that.
I'll let Rebecca second
Let's
that.
do it.
And
Let's do
I
it.
will do a roll call vote to close the meeting. Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
All right, ladies, the Board of Health meeting for tonight is closed. Have a lovely evening, everyone.
Bye,
Thank you
everybody.
so much.
Bye, everybody.